Hello everyone, welcome to my page. If you are watching me on TikTok or Facebook, welcome to my page. If you are watching me on YouTube, I welcome you to my channel as well. Today I'm going to talk about birth preparation and stages of labor. I'm going to talk about what to expect during labor, and if you have any question you can ask me, which I will attend to. Don't go away. Let's dive in into it together. And we should have it in mind that normal labor is a labor that initiates after 37 weeks of pregnancy. Anything before that is known as a preterm contraction. Any contraction that's happened before 37 weeks is a preterm contraction. For any pregnant woman experiencing this should seek health care immediately. As a pregnant woman, are you ready to embrace the journey of labor? So let's talk about the stages of labor. Labor has three stages. The first stage is the dilation of the cervix from 0 to 10 centimeter, and the second stage is the delivery of the baby, and the third stage is the expulsion of the placenta or the delivery of the placenta. At the first stage, it has three phases: the latent phase, active phase, and the transition phase. In the latent phase, this is dilation of the cervix from 1 to 3 centimeters. In this stage, the woman will be in an excited phase that the D-Day have come, that the D-Day has already come. So this will be focused on the delivery of the baby. And at this stage, you have minor contraction, which can be coming in 5 minutes interval or 10 minutes interval. Nobody can determine the patterns of how the contraction will be coming. At this stage, if you are at home and it happened during the day, you can be up doing so that the baby head can descend to the pelvic region in preparation for the birth of the baby. If it happened during the night, it's advisable for you to sleep because you still have some hours to go before the delivery of the baby at this stage. If the membrane is intact, that has not ruptured, you can wait till when you are having moderate contraction before going to the hospital. Depend on where you are living and your accessibility to the healthcare facility where you plan to deliver your baby. Moving on to the transition stage of labor, that is when the cervix is dilated from 7 centimeter to 10 centimeter. At this stage, you are going to be having a strong contraction, and nature plays it in such a way that it's towards the delivery of the baby you'll be having that strong contraction. And this depends on if you are using epidural or any pain relief to help you to have a good experience of labor. It's very essential. When the cervix is 10 centimeter dilated, this stage completed the first stage of labor. At the second stage of labor, the cervix has already fully dilated, dropped, and the baby has descended and engaged. So at this stage, you'll be having a strong contraction and the sensation to suddenly bear down. You have to control yourself. Don't suddenly bear down at this stage. Have a control birth at the second stage of labor so that you not have any genital tears. Listen to the instruction of your birth attendant, the licensed birth attendant, the midwives, obstetric and gynecologists with you. This is very important. After the delivery of the baby, you feel more relaxed and the pain will reduce. But that does not end there. We are going to move to the third stage of labor, which is the delivery or expulsion of the placenta. The placenta has to come out, and you have to listen to the instruction of your birth attendant as well until when the placenta separated. That is when it can be delivered. So you have to listen to the instruction as well for the delivery of the placenta. And later after that, it's going to be the recovering phase, whereby you're going to be monitored if there is any tears, or where you're going to be monitored to prevent postpartum bleeding. Depend on the hospital protocol, they may give you oxytocin or misoprostol to prevent bleeding. Another thing you can do if you fit to do that is to put your baby to breast. This will help contraction, and with the contraction of the uterus will prevent any bleeding, and this will make you safe, and this will prevent any postpartum bleeding, and they will check on you and monitor your baby as well at this stage. So this is all about the stages of. I've come to the end of this video. Thank you for staying with me to the end. If you have stayed with me to the end of this video, and I wish every expectant mother a happy delivery, healthy babies to healthy family. Until next time, I will be doing another video. Take complete charge of your health. Bye for now.